What if I told you that some of the most common pills sitting in your medicine cabinet right now could be silently affecting your memory? We've all had those moments. You walk into a room and forget why. You can't remember a name you've known for decades. You misplace your keys for the third time this week. Most of us chuckle it off as a senior moment or blame it on stress. But what if the reason isn't just aging? What if it's the very medications prescribed to keep you healthy? Welcome to Bio Living, the only channel on YouTube dedicated to make your life healthier naturally and share hidden knowledge every day. If you are new, subscribe now so you don't miss our daily uploads. Today, we're going on a deep dive into a topic that is both concerning and empowering. We are going to explore 8 common categories of medications that have been linked in scientific studies to an increased risk of cognitive decline and dementia, including Alzheimer's disease. Now, before we go any further, I want to make one thing crystal clear. This information is not medical advice. I am not telling you to stop taking any of your medications. Many of these drugs are life-saving. They treat serious conditions like high blood pressure, depression, and pain. Stopping them abruptly can be dangerous and even life-threatening. What I am offering you is information, the power of knowledge, the ability to have an informed conversation with your doctor about the risks and benefits of every single pill you take. Think of this as a guided tour of your medicine cabinet. We're going to open it up, look at what's inside, and understand what the science says about each one's potential long-term impact on that 3-pound universe inside your head, your brain. The idea that medications could affect our memory isn't new. In medical school, doctors learn about the blood-brain barrier, a filter that protects our brain from harmful substances. But many drugs are specifically designed to cross this barrier to work, and others slip through unintentionally. When they do, the human brain is the most complex organ in the body. It operates on a network of billions of neurons firing in precise patterns. Neurotransmitters, the brain's chemical messengers, play a crucial role in this process. Acetylcholine, for instance, is one of the most critical neurotransmitters for memory and learning. When you form a new memory, it's because acetylcholine is doing its job, passing signals from one brain cell to another. If something interferes with this system, say, a drug that blocks acetylcholine, then your ability to learn and remember can be compromised. So, let's begin our journey. The first category of medication on our list is perhaps the most notorious and also the most surprising to many people. Anticholinergic drugs, the memory thieves. When I tell people that common over-the-counter allergy pills or prescription medications for overactive bladder are linked to memory loss, they often look at me in disbelief. But the evidence is substantial. A class of drugs called anticholinergics literally works by blocking the action of acetylcholine in the brain and body. Think about that for a moment. If acetylcholine is essential for memory and this medication blocks it, what do you think happens to your memory? A landmark 2020 study published in the journal Neurology found that people taking at least one anticholinergic medication were 47% more likely to develop cognitive impairment. 47%. And the risk was even higher for those with a genetic predisposition to Alzheimer's disease. So, what kind of medications are we talking about? The list is eye-opening. First, many overactive bladder medications like oxybutynin, tolterodine, and sulfenacin fall into this category. If you're taking a medication to calm an overactive bladder, it is highly likely to be an anticholinergic. A 2025 study published in BMJ Medicine found a modest to strong association between these bladder medications and dementia, depending on the specific drug and study. The biological plausibility is there. These drugs work by blocking acetylcholine in the bladder to reduce contractions, but they don't just stay in the bladder. They travel throughout your body and cross into your brain. Keep watching because the last one will surprise you. Second, many allergy medications, particularly older, first-generation antihistamines like diphenhydramine, Benadryl, are anticholinergics. These drugs are often found in over-the-counter sleep aids too. It's ironic, isn't it? You take a sleeping pill because you can't sleep, but you might be harming your brain in the process. A study mentioned in Chinese medical literature highlighted that first-generation antihistamines bind to about 75% of H1 receptors in the brain, causing sedation and, crucially, significant anticholinergic effects. They are known to cause a decline in cognitive and executive function. Then we have certain antidepressants, specifically the older tricyclic antidepressants and anti-Parkinson drugs like benztropine, even some anti-nausea medications and certain muscle relaxants. A 2018 review in Behavioral Neurology reported that in elderly people taking antidepressants, especially tricyclic or MAOI types, is significantly associated with an increased risk of dementia. The concern is so serious that researchers are calling for more judicious prescribing. A 2025 editorial published by the NIH suggests that while a direct causal link between anticholinergic bladder drugs and dementia remains unproven, the evidence is strong enough to recommend starting with non-drug interventions like pelvic floor muscle training or bladder training before resorting to these medications, particularly in older adults. They even suggest that a beta-3 agonist like mirabegron, which doesn't have the same cognitive risks, should be the preferred option. So, if you're taking any of these medications, you mustn't stop them abruptly, but you absolutely must ask your doctor, is there an alternative? Is this medication absolutely necessary? And what are the long-term risks to my memory? If this is making sense, then like the video right now and share it with someone who it could help. It helps the channel and US to make more videos like this. Benzodiazepines and sedatives, a double-edged sword. Let's talk about anxiety, insomnia, and the medications that promise relief. Benzodiazepines are a class of drugs that millions of people use to manage anxiety, panic attacks, and sleep issues. You've heard of them: Valium, Xanax, Ativan, Klonopin. They are effective, they are powerful, and they are potentially very dangerous for your brain when used long-term. Brain imaging studies, specifically SPECT scans, have shown that benzodiazepines decrease overall blood flow to the brain and reduce cerebral activity. Less blood flow means less oxygen and fewer nutrients reaching your brain cells. Over time, this can lead to memory problems, confusion, and a significant increase in the risk of dementia. A large Canadian case control study published in 2025 in the Journal of the Neurological Sciences found that any use of benzodiazepines was associated with a 65% higher risk of dementia. Think about that number, 65%. And the risk was even higher, a staggering 181% increase for those taking long-acting benzodiazepines compared to short-acting ones. Long-acting benzodiazepines like diazepam stay in the system much longer, accumulating and constantly impacting brain function. The study also made an important observation. They found that chronic use, defined as more than 180 days, was strongly linked to dementia, but the association was especially pronounced within the 4 years leading up to a diagnosis. This raises the chicken and egg question: are benzodiazepines causing dementia, or are early, undetected symptoms of dementia, like anxiety and insomnia, prompting people to take these medications in the first place? If all this sounds complicated, just bear with me, it will all make sense at the end. It's a classic problem in medical research called reverse causality. The researchers concluded that while some of the risk might be due to early dementia symptoms, the strong association, even after adjusting for these factors, strongly suggests that the medications themselves are contributing to the problem. The evidence stresses cautious, time-limited prescribing of benzodiazepines in older adults. They are not intended for long-term use. What about sleep medications that aren't benzodiazepines? Drugs like Ambien and Lunesta belong to a class called Z-drugs. They act similarly and aren't much better. A 2023 study published in the Journals of Gerontology found that using any sleep medication was associated with a 48% increased risk of dementia. These drugs may also reduce critical REM sleep, which is essential for memory consolidation. So, you get a night of sleep, but it's a shallow, chemically induced sleep that does little to restore your brain. Here's a startling fact from a Canadian study on benzodiazepine use. Among adults over 65, the average duration of benzodiazepine use was 205 days per year. That's more than half the year. Almost half of the users received at least one potentially inappropriate prescription. This isn't a failure of patients. It's a failure of the healthcare system to adequately manage chronic anxiety and insomnia without relying on harmful medications long-term. Cholesterol-lowering drugs, statins, the controversy. Statins, one of the most prescribed classes of drugs in the world. This is where things get really contentious. Statins are used to lower LDL cholesterol and prevent heart attacks and strokes, conditions that kill millions every year. Clearly, they are life-saving. But what about their effect on the brain? Cholesterol is vital for the brain. About 20% of your body's cholesterol is in the brain, more than in any other organ. Brain cells require cholesterol to function and communicate properly. So, the theory is, if you lower cholesterol too much, you might damage the brain and affect memory. For years, case reports and observational studies have flagged memory loss and cognitive issues as potential side effects of statins. This has caused widespread fear, with many people refusing to take their statins. However, the scientific evidence has recently taken a decisive turn. A massive, definitive review published in The Lancet in 2026 by the Cholesterol Treatment Trialists Collaboration analyzed data from 23 large-scale randomized trials involving over 154,000 participants. This is the gold standard of evidence. The study, conducted by researchers at Oxford Population Health, found that statins do not cause the majority of side effects listed in their package leaflets, including memory loss. The numbers are compelling. Each year, reports of cognitive or memory impairment were 0.2% in those taking statins, but also 0.2% in those taking the placebo. There was no statistically significant excess risk. The researchers concluded that the long list of adverse outcomes currently stated as potential treatment effects on labels is based mainly on case reports and observational studies that might be subject to bias. Interestingly, a more recent study in 2025 from the Swedish Registry for Cognitive/Dementia Disorders found that the statins atorvastatin and simvastatin were actually associated with the best cognition cluster in patients with Alzheimer's disease. They had a positive association with cognition. This suggests that statins, by improving cardiovascular health and reducing inflammation, might actually be protective for the brain. So where does that leave us? It means that when you look at your medication list, statins might actually be one of the few drugs where the balance of evidence is shifting in their favor for brain health, provided you have a legitimate need for them. Antidepressants. A nuanced picture. Antidepressants are the third most commonly prescribed medication in the United States. Millions rely on them to manage depression and anxiety, but their impact on the brain is complex and far from fully understood. And by the way, if you are the kind of person who takes their health seriously and you want to learn about modern medicines and their alternative herbal remedies, you should check out our research book on the topic called The Natural Pharmacy. We also have a 90-day guide plan to completely heal and transform your body naturally. The link to the ebook will be in the description of this video. Now back to the topic. The earlier tricyclic antidepressants, like amitriptyline, are, as we mentioned, anticholinergic. They block acetylcholine, and studies have linked them to an increased risk of dementia. A 2018 review in behavioral neurology found that in elderly people, taking these types of antidepressants was significantly associated with an increased risk of dementia. But what about the more modern SSRIs, like fluoxetine, Prozac, or sertraline Zoloft? These work on serotonin, not acetylcholine. The picture here is much more complicated. A 2024 retrospective cohort analysis published in Frontiers in Psychiatry analyzed data from over 300,000 patients and found something truly eye-opening. It showed that exposure to CNS-active drugs, which included antidepressants, was associated with a decreased risk of Alzheimer's disease. Specifically, antidepressants were linked to a significantly reduced risk. Another analysis showed that for patients aged 70 or older, long-term therapy with these drugs, over 3 years, provided the greatest risk reduction. So why the discrepancy? It all comes down to the specific drug, the population being studied, and the context. One crucial factor is the prodromal stage of dementia. Depression and anxiety are common early symptoms of dementia, appearing years before the memory loss becomes apparent. If a patient is prescribed an antidepressant for these symptoms and then develops dementia a few years later, it might appear that the antidepressant caused the dementia, when in reality, the dementia caused the depression. This is the same reverse causality we saw with benzodiazepines. Overall, the evidence suggests that the older tricyclic antidepressants and MAOIs should be avoided in the elderly, while the newer SSRIs and SNRIs may be neutral or even potentially protective, especially if they successfully treat underlying depression. Depression itself is a risk factor for dementia, so treating it effectively is crucial. The message remains, always ask your doctor whether the antidepressant you are taking is the best choice for you, considering your age and overall risk factors. Opioid painkillers, the silent cognitive culprit. The opioid epidemic has brought these powerful painkillers into the spotlight. But beyond the obvious dangers of addiction and overdose, opioids can profoundly affect your memory. Opioid pain medications, like oxycodone, hydrocodone, and morphine, block pain signals by binding to receptors in the central nervous system. But these same receptors are also involved in critical cognitive functions. The chemical messengers that opioids disrupt are also crucial for memory formation. Research published in Pain Physician found that long-term opioid use led to cognitive impairment, including working memory deficits, decreased spatial memory, and more. This means that people on these drugs often have trouble remembering things in the short term, struggle with problem solving, and experience brain fog. The problem is often dismissed because the drug is treating pain, but the cognitive side effects can be just as debilitating as the pain itself. The relationship is dose-dependent. The higher the dose and the longer the duration, the greater the risk to your memory. It's another stark reminder that the drugs we take for immediate relief can have devastating long-term consequences. Sleep aids, the paradox of rest. We touched on this earlier, but it's so important we need to delve deeper. The irony is profound. You take a sleeping pill because you can't sleep, but that very pill may be preventing your brain from getting the deep, restorative sleep it needs. Sleep is not passive. It's an active state during which the brain clears out toxins, consolidates memories, and repairs itself. This is when your brain flushes away amyloid plaques, a hallmark of Alzheimer's disease. Interfering with this natural process is a recipe for disaster. As mentioned, medications like Ambien and Lunesta can reduce critical REM sleep. They may knock you out, but they disrupt your brain's natural sleep architecture. A 2023 study in the Journals of Gerontology found that using sleep medication was associated with a 48% increased risk of dementia. The evidence is overwhelming. What's particularly concerning is the extended duration of use. Many people start taking a sleep aid for a short-term problem and then can't stop. They become dependent. What started as a temporary solution becomes a long-term habit that threatens their cognitive health. Anti-seizure drugs, anticonvulsants, slowing down the brain. Anti-seizure medications are used to treat epilepsy, nerve pain, and even mood disorders like bipolar disorder. These drugs work by calming abnormal electrical activity in the brain, but in doing so, they can slow down normal brain activity, too. A 2018 study indicated that using anti-epileptic drugs for more than 1 year significantly increases the risk of Alzheimer's disease and other types of dementia. There's a biological rationale. Slowing down electrical signals in the brain is the whole point of the drug, but doing so over the long term may have neurodegenerative consequences. Additionally, many anticonvulsants have anticholinergic properties, which, as we already discussed, can further exacerbate the risk to memory and cognition. Just another reason to carefully evaluate the risks and benefits of these powerful medications. General anesthesia. Now, this one is a bit different. General anesthesia isn't something you take at home. It's something you undergo during surgery. But it's worth mentioning because of the sheer volume of surgeries performed every year and the growing body of evidence about its impact on the brain. Research on the relationship between general anesthesia and memory problems is mixed, but a paper in Alzheimer's and dementia found an increased risk of dementia in people with a history of general anesthesia. A before and after SPECT study of patients who underwent coronary artery bypass surgery found that 68% had diminished blood flow, which was linked to decreased verbal and visual memory 6 months later. These findings are significant. The theory is that the inflammatory response triggered by major surgery and the effects of anesthetics on the brain's delicate chemistry can set the stage for cognitive decline. While we can't always avoid surgery, it's something to be aware of, especially for older adults. Proton pump inhibitors, PPIs, the heartburn puzzle. Finally, let's talk about acid reflux. Proton pump inhibitors, PPIs, like omeprazole, pantoprazole, and lansoprazole are some of the most widely prescribed drugs in the world. They are marvels of modern medicine for treating heartburn and ulcers, but they are also significantly overused. The evidence linking PPIs to dementia is a fascinating puzzle. Some studies have shown a link, but the evidence is inconsistent. Some of the most rigorous studies, including a 2024 Mendelian randomization study that uses genetics to assess causation, found no robust causal link between PPI use and an increased risk of dementia. However, a 2026 meta-analysis found a lack of consistent evidence, but also found significant subgroup signals in older adults, suggesting a possible vulnerability. Another study found a modest association between PPI use and dementia that could be explained by bias. So what's the truth? The weight of the most rigorous evidence suggests that PPIs likely don't cause dementia. However, there are still several theories on the biological mechanisms that could cause harm. One is that PPIs interfere with the absorption of vitamin B12, which is essential for healthy nerve function and cognitive health. Another is that they may affect the amyloid beta pathway or cholinergic pathways in ways we don't fully understand. The real problem with PPIs is not necessarily the drug itself, but the overuse of the drug. Many people take them for years, long after the original issue, like a peptic ulcer, has healed. They take them just in case. This is the definition of unnecessary medication. The evidence strongly suggests that if you don't need a PPI, you shouldn't be taking one. And if you do need one, you should be on the lowest effective dose for the shortest possible duration. If you have watched the video till here, that means you take your health and wellness very seriously. So I have a list of even more medicines that might affect your body. Let me know in the comments before we move further if you are liking the video and where you are from. I read all the comments. Now, let's shift our focus to something that might surprise you even more. We've talked about medications that directly alter brain chemistry, but what about drugs that affect your body in ways that indirectly harm your brain over time? This is where the conversation gets even more fascinating and, frankly, a bit unsettling, because the brain doesn't exist in a vacuum. It's part of an interconnected system, and what you take for your heart, your blood pressure, or even your allergies can create a cascade of effects that ultimately reach your neurons. So let's continue our journey through the medicine cabinet, because we're only halfway through, and the next few categories might just be the most eye-opening of all. Consider this for a moment. Your brain is the most energy-hungry organ in your body. It represents only about 2% of your body weight, yet it consumes roughly 20% of your oxygen and glucose. That means it requires a constant, robust supply of blood to function properly. Anything that compromises that blood flow, even slightly, is going to have consequences for your cognitive abilities. And this is precisely where certain cardiovascular medications enter the picture, not necessarily as direct toxins, but as agents that can tip the delicate balance of cerebral circulation. Now, before anyone panics, let me be very clear about something. High blood pressure itself is one of the most significant risk factors for dementia. Untreated hypertension damages the tiny blood vessels in your brain, leading to white matter lesions and microbleeds that are strongly associated with cognitive decline. So treating high blood pressure is absolutely essential. The question is not whether to treat it, but how to treat it and with which medications. The controversy here centers on a class of drugs known as calcium channel blockers. These are commonly prescribed for high blood pressure and certain heart conditions. Some early observational studies raised concerns that these medications might increase the risk of dementia. But here's the thing about science. It evolves. Newer, larger studies have painted a much more reassuring picture. A 2024 study published in the journal Neurology looked at over 15,000 participants and found that calcium channel blockers were actually associated with a lower risk of dementia compared to other antihypertensives. The researchers speculated that these drugs might have protective effects on the blood-brain barrier or might reduce the formation of amyloid plaques. So what we're seeing is a complete reversal of the initial concern. The takeaway here is that medications are complex, and our understanding of them is constantly evolving. What was considered risky a decade ago might now be seen as protective. This is precisely why you need to have ongoing conversations with your doctor. The medication you started 5 years ago might not be the best choice for you today, given the latest evidence. Then there's the matter of diuretics, sometimes called water pills, which are also used to treat high blood pressure. These work by helping your body eliminate excess fluid. Some studies have suggested a slight increased risk of dementia with certain diuretics, particularly those that deplete potassium levels. Since potassium is essential for nerve function, the theory is that chronic depletion could affect brain signaling. However, other studies have found no association or even a protective effect. Once again, the evidence is mixed and often contradictory. What this tells us is that we cannot paint all drugs in a category with the same brush. Individual medications within a class can have vastly different effects, and individual patients can have vastly different responses. This is the art and science of medicine. It's about personalized care, not one-size-fits-all prescriptions. Now, let's move into a territory that has generated a tremendous amount of debate and confusion over the past few decades. I'm talking about hormone replacement therapy, or HRT, which is used to manage menopausal symptoms in women. This is an area where the pendulum of scientific opinion has swung wildly back and forth, leaving many women confused and anxious about what's safe for their brains. Estrogen has long been known to have neuroprotective properties. It promotes the growth of neurons, enhances synaptic plasticity, and even increases blood flow to the brain. So it made perfect sense that replacing estrogen after menopause, when natural levels plummet, would protect against cognitive decline. An early observational study supported this. Women who used hormone replacement therapy seemed to have a lower risk of Alzheimer's disease. But then came the Women's Health Initiative Memory Study in the early 2000s, a massive, randomized controlled trial that sent shockwaves through the medical community. The study found that older women who took combined estrogen and progestin therapy actually had a higher risk of dementia, not lower. The results were so dramatic that the study was stopped early. Millions of women stopped their hormone therapy overnight. The medical establishment did a complete 180, and suddenly HRT was seen as dangerous. Subsequent analyses and follow-up studies revealed a much more nuanced picture. The increased risk seemed to be primarily in women over the age of 65, particularly those who started hormone therapy many years after menopause, what researchers call the critical window hypothesis. The idea is that estrogen has a protective effect on the brain, but only if it's introduced at the right time, soon after menopause, before the brain has undergone significant age-related changes. Starting it later, when the brain has already begun to deteriorate, might actually be harmful. A 2023 study published in the journal Alzheimer's and Dementia looked at this issue and found that women who initiated hormone therapy within 5 years of menopause had a significantly lower risk of developing Alzheimer's disease compared to those who never used it. Conversely, women who started it more than 10 years after menopause had a higher risk. The timing was everything. This is a perfect example of why you can't just look at a headline and make a decision. The devil is truly in the details. The dose matters. The type of hormone matters. The route of administration matters. And crucially, when you start matters. It's also worth noting that other studies have looked at testosterone therapy in men, and while the evidence is much thinner, there are some indications that low testosterone in men might be linked to cognitive decline, and that replacement therapy could potentially help. But once again, the evidence is not definitive, and we need more research. Now, let's talk about something that virtually everyone has in their medicine cabinet at some point. I'm talking about non-steroidal anti-inflammatory drugs, or NSAIDs. These include ibuprofen, naproxen, and aspirin, among others. They are used for everything from headaches to arthritis to minor injuries. And for years, there was enormous excitement in the scientific community about the potential of these drugs to prevent Alzheimer's disease. Because inflammation is a key driver of Alzheimer's pathology, the idea was that reducing inflammation with NSAIDs could slow or prevent the disease. But the clinical trials failed. Not only did they fail to show a benefit, but some even showed that certain NSAIDs could worsen cognitive function or increase the risk of stroke and heart attack. The most famous of these was the Alzheimer's disease anti-inflammatory prevention trial, which found that the NSAID celecoxib actually increased the risk of cognitive decline. It was a devastating blow to the inflammation hypothesis. But as we've learned, the story is never that simple. Subsequent research has suggested that the protective effect might depend on the specific genetic profile of the individual. For example, people with certain variants of the APO gene, which is the strongest genetic risk factor for Alzheimer's, might respond differently to NSAIDs than those without the variant. There's also the issue of the blood-brain barrier. Some NSAIDs simply don't penetrate the brain well enough to have an effect. And then there's the timing. NSAIDs might need to be taken decades before symptoms appear, and most clinical trials enrolled people who already had some degree of cognitive impairment. It might simply have been too late. The most recent evidence, including a 2025 meta-analysis, suggests that the relationship between NSAIDs and dementia is complex and likely depends on the specific drug, the dose, the duration of use, and the individual characteristics of the patient. For the average person taking an occasional ibuprofen for a headache, there's no reason to worry. But for someone considering long-term, daily use for chronic pain, this is a conversation you absolutely need to have with your doctor. Because chronic inflammation is itself a risk factor for dementia, but the drugs used to treat it might not be the answer, or they might only work in specific subgroups of people. Let's talk about chemotherapy now. This is a completely different category because these drugs are used to treat cancer, and their primary purpose is to kill rapidly dividing cells, which include cancer cells. But unfortunately, they also affect other rapidly dividing cells in the body, including those in the brain. The phenomenon is so well known that it has a name, chemobrain. And for the millions of cancer survivors out there, this is not a theoretical concept. This is their daily reality. They experience memory lapses, difficulty concentrating, trouble finding words, and a general feeling of mental fogginess that can persist for years after treatment ends. The exact mechanisms are still being studied, but researchers believe that chemotherapy drugs can cause inflammation in the brain, damage to the DNA of brain cells, and even a reduction in the number of new neurons being formed in the hippocampus, which is the memory center of the brain. A 2022 study published in the Journal of Clinical Oncology followed breast cancer patients for 5 years after chemotherapy and found that a significant proportion of them had measurable cognitive deficits that persisted over time. Brain imaging studies have shown structural changes in the brains of chemotherapy patients, including reduced volume in certain areas and altered connectivity between different brain regions. This doesn't mean that chemotherapy is a bad thing. It's often a life-saving treatment, but it does mean that oncologists and patients need to weigh the benefits against the potential cognitive costs. And there's growing interest in finding ways to mitigate these effects, perhaps through cognitive rehabilitation, exercise, or even medications that might protect the brain during treatment. Because survivorship is not just about living longer. It's about living better, with a quality of life that includes a sharp and active mind. Now, we need to talk about what might be the single most important medication category in terms of sheer volume of use worldwide: antibiotics. We don't normally think of antibiotics as affecting our memory. They kill bacteria, right? What does that have to do with the brain? But here's where the story gets incredibly interesting and, for many, alarming. Our understanding of the gut-brain axis has exploded over the last decade. We now know that the trillions of bacteria living in our digestive tract, collectively known as the microbiome, exert a profound influence on our brain health. These bacteria produce neurotransmitters, regulate inflammation, and even affect the integrity of the blood-brain barrier. Disrupting this delicate ecosystem with antibiotics could have unintended consequences for cognition. A groundbreaking study published in 2023 in the journal Neurology found that people who took antibiotics for more than 2 months had a significantly higher risk of developing dementia compared to those who never took them. The risk was particularly pronounced with broad-spectrum antibiotics, which kill a wide range of bacteria, both good and bad. The researchers speculated that the disruption of the gut Antibiotics are miracle drugs. They have saved countless lives, but they are also overprescribed, particularly for viral infections where they have no effect whatsoever. Every course of antibiotics is a significant perturbation of your internal ecosystem, and it's not without consequences. This doesn't mean you should refuse an antibiotic when you genuinely need one, for a bacterial pneumonia or a severe skin infection, for example. But it does mean that you shouldn't demand an antibiotic for a common cold. It means that doctors should be more judicious in their prescribing and consider the long-term implications for their patients' gut health and, by extension, their brain health. And it means that after a course of antibiotics, the emerging field of psychobiotics, which explores how gut bacteria can influence mental health, is one of the most exciting frontiers in medicine, and it all stems from the realization that our brain is not an island, but part of a larger, interconnected system that includes our gut, our immune system, and even the environment around us. We're also starting to see research on the potential cognitive effects of immunosuppressant drugs, which are used to prevent organ rejection after transplantation and to treat autoimmune diseases like rheumatoid arthritis and multiple sclerosis. These drugs work by dampening the immune response. But as we've seen, the immune system plays a crucial role in clearing amyloid plaques and other toxic proteins from the brain. So, theoretically, long-term suppression of the immune system could increase the risk of dementia. The evidence is preliminary and somewhat contradictory. A 2021 study found an increased risk of dementia in transplant patients on immunosuppressants, but it's hard to tease out whether this is due to the drugs themselves or the underlying medical conditions or the stress of the transplant procedure. More research is needed, but it's another category worth being aware of. And what about antiviral medications? These are used to treat herpes, HIV, and hepatitis, among other conditions. There's some intriguing evidence, though still preliminary, that certain antivirals might actually protect against dementia by preventing viral reactivation in the brain. Herpes simplex virus, for example, has been linked to Alzheimer's disease. So, treating the virus might reduce the risk. But other antivirals have been associated with cognitive side effects. A 2022 study found that certain HIV medications were linked to cognitive impairment in some patients, though the exact cause remains unclear. This is a rapidly evolving field, and our understanding of the relationship between infections, antiviral drugs, and cognitive function is still in its infancy. We also need to consider the role of herbal supplements and over-the-counter remedies. Many people assume that if something is natural or available without a prescription, it must be safe. But that is a dangerous assumption. Ginkgo biloba, for instance, is often taken to improve memory, but high doses can increase the risk of bleeding and may interfere with other medications. Some supplements, like those containing high doses of heavy metals, can be toxic to the brain. Even common supplements like iron and copper, when taken in excess, can contribute to oxidative stress and damage to brain cells. The supplement industry is largely unregulated, and many products don't contain what they claim on the label. So, when we talk about medications that affect memory, we need to include these over-the-counter products as well. Your daily multivitamin is probably fine, but if you're taking high doses of individual supplements, especially without medical supervision, you could be doing more harm than good. Let's take a moment to think about the bigger picture here. We've talked about 8 common categories of medications, but we've also touched on several more. And the underlying theme is this: no drug is without risks. Every medication has potential side effects, and some of those side effects can be subtle and develop over years. The problem with cognitive side effects is that they can be easy to dismiss, especially as we get older. We chalk it up to normal aging. We blame stress or lack of sleep. We don't make the connection to the pill we've been taking faithfully for a decade. And doctors don't always think to make that connection either. They're focused on the primary purpose of the drug, lowering blood pressure or treating depression, and they may not be up to date on the latest research about cognitive risks. This is why you need to be your own advocate. You need to be informed. You need to be proactive. And you need to have candid conversations with your healthcare providers. When you get a new prescription, ask your doctor, what are the potential side effects on cognition? Are there alternatives that are safer for the brain? Do I really need this medication, or is there a non-pharmacological approach I can try first? And for the medications you're already taking, ask yourself, do I still need this? Is the dose still appropriate? Have there been new studies that might change the risk-benefit calculation? This is not about being paranoid. It's about being empowered. It's about taking control of your health in a world where easy answers are often wrong and where the solution to one problem can create a whole new set of problems down the line. And let's not forget the psychological impact of all this. The anxiety that comes from realizing that a medication you've been relying on might be harming your brain can be profound. It can lead to stress, which in turn can impair your memory and cognitive function further. So, it's important to approach this with a sense of balance. Don't panic. Don't make any sudden changes. Arm yourself with information, talk to your doctor, and make thoughtful, deliberate decisions. The goal is not to become afraid of medication. The goal is to become a more informed and active participant in your own healthcare. There's also the issue of polypharmacy, which is the concurrent use of multiple medications. This is particularly common in older adults who may have multiple chronic conditions. Each drug individually might have a small effect on cognition, but their effects can interact and amplify each other in unpredictable ways. If you're taking a benzodiazepine for sleep, an anticholinergic for bladder control, and a statin for cholesterol, the net effect on your brain could be much greater than the sum of its parts. This is why medication reviews are so important. A pharmacist or a geriatrician can look at your entire medication list and identify potential drug interactions and opportunities to simplify your regimen. Sometimes, simply reducing the number of medications you take can have a dramatic impact on your cognitive function. So, as we move toward the conclusion of this deep dive, I want you to think about your own medicine cabinet. I want you to make a list of every prescription, every over-the-counter pill, every supplement you take. Then, I want you to do some research. Look up each medication and see what the latest scientific literature says about its potential cognitive effects. Don't rely on a single study or a sensationalized headline. Look for systematic reviews and meta-analyses, which synthesize the evidence from many studies. And then, take that list to your doctor and have a conversation. Ask them to justify each medication. Ask them if there's a safer alternative. Ask them about the long-term risks. This is not about being confrontational. It's about being collaborative. Your doctor is your partner in your health journey, and a good doctor will welcome your questions and your engagement. And finally, remember that your brain is resilient. It has an amazing capacity to heal and adapt. By making informed choices about your medications, you can minimize the risks and maximize your chances of maintaining a sharp, clear mind well into your later years. Because at the end of the day, that's what we all want. We want to live long, yes, but more importantly, we want to live well. We want to remember the faces of our grandchildren. We want to tell stories about our youth. We want to recognize the world around us and be an active part of it. Our medications should serve that goal, not undermine it. So take charge, ask questions, stay informed.